Hi there, a bit of a sensitive topic today, but we're going to be talking about Diltiazem ointment, and we can also put nifedipine into that same category as well. So Diltiazem is a medicine that belongs to a group called calcium channel blockers, generally used in a tablet for cardiovascular issues. It's a prescription only medicine, so talk to your doctor first. And what we're talking about today is not that. We're actually talking about a compounding pharmacy using Diltiazem in an ointment. So the beauty of compounding is that we can take an ingredient that's used in a tablet, for example, but we can put it into a base that's different, the ointment, and it can actually have a really beneficial effect in a different area of the body. So the ointment, Diltiazem ointment, is used generally rectally. Things like chronic anal fissures where it typically exerts benefit, and it's used in situations where over-the-counter or pharmacist-only medicines might not be sufficient. So those products could be proctocidal, for example, or rectogesic. And when you get something like an anal fissure, it's a very small tear in the lining of the anal canal. So it can put people into a lot of distress, a lot of pain, a lot of discomfort. And because of the location of it, it's really, really slow to heal. So when you use a Diltiazem ointment, generally from a compounding pharmacy, what it does is it relaxes the smooth muscle in this area, and that helps to improve the blood flow, which in turn helps the healing and also reduce the pressure of that area. So it can really benefit people that are very uncomfortable and in a bit of distress. Normally, the doctors will, this is definitely a prescription only medicine. Doctors will specify how often to use it. Typically we see it's about 3 times a day, and someone would normally measure about a pea-sized amount, so about a quarter of a 5-cent piece, onto clean fingers or gloves, and then apply it rectally. And obviously there's some side effects that might occur from these types of medicines. Things like irritations or soreness on application of the ointment is one of them. Sometimes headaches due to the muscle relaxation effect and the active ingredient can occur, but rarely things like lightheadedness or dizziness. So it's one of those really good examples of where a compounding pharmacy can fill a void that big pharma may not have been able to make a product for. It's one of those things that we can add other ingredients such as anesthetics to help numb the area too. So if it's something that you are suffering from, have a chat to your GP or your specialist. They can talk to our compounding pharmacists and we can make a formulation that's well suited to yourself. So if you've got any questions, like always, reach out and we'll speak to you soon. Thank you.